A major news study has brought to light a concerning link between antidepressant use and obesity, revealing that millions of Americans who rely on these drugs to manage their mental health may face a significantly increased risk of gaining weight. This could potentially lead to a range of other health issues, compounding the very problem these medications are meant to alleviate. According to the study, which tracked over 3,000 adults in Spain, people who took antidepressants for an average of 6 years gained up to twice as much body weight as those who didn't use the drugs. Even after controlling for factors like diet, exercise, and overall mental health, the effects of long-term antidepressant use on body weight remain strikingly significant. The data suggests that roughly 1 in 4 participants who used antidepressants gained more than 5% of their body weight during the study period, a gain that is linked to a higher risk of developing serious health conditions such as diabetes, heart disease, and joint problems. This study's findings underscore a serious, yet often overlooked, side effect of antidepressants. While these medications, particularly selective serotonin reuptake inhibitors (SSRIs), have proven effective in treating depression and anxiety by boosting serotonin levels in the brain, they come with significant risks. The most notable of these risks, as highlighted in the study, is weight gain. SSRIs, which include popular drugs like Prozac, Zoloft, and Cymbalta, are known to disrupt the body's natural regulation of hunger and satiety, often leading to increased cravings and overeating, especially as the body builds up a resistance to serotonin over time. This can result in the patient eating more and gaining weight, a side effect that many individuals are ill-prepared for when they first start treatment. The impact of these medications on weight gain is not trivial. For those who take antidepressants long-term, the weight increase can be substantial. The study's results revealed that long-term users gain an average of 1.7% of their body weight over the course of 6 years, a seemingly modest amount, but one that still poses a serious risk of obesity. For those who started antidepressant treatment during the study, the average weight gain was even higher at 2.5%. These figures are alarming, considering that even a small increase in body weight can have significant long-term health consequences. A gain of 5% or more of one's body weight, as observed in 1/4 of participants, is medically linked to an increased risk of metabolic disorders, including type 2 diabetes, cardiovascular disease, and joint complications. Despite the many benefits antidepressants offer in terms of mood regulation, the weight gain associated with these medications has become one of the leading reasons people discontinue treatment. Patients often stop taking their medications due to frustration with the side effects, especially when they begin to notice their clothes fitting tighter or when they find themselves struggling to maintain a healthy weight. For some, the weight gain becomes unbearable and they seek alternative treatments, sometimes without fully understanding the risks of discontinuing their medication abruptly. This can result in withdrawal symptoms, which can be severe and difficult to manage. Flu-like symptoms, dizziness, mood swings, and brain zaps are common withdrawal experiences that can make patients hesitant to stop their antidepressants, even if they want to address the weight gain. It's important to note that not all antidepressants have the same impact on weight, and the effects vary widely from person to person. Drugs like mirtazapine and paroxetine have been shown to cause particularly significant weight gain, while others may have a less pronounced effect. However, the overall trend in the study was clear. Those who used antidepressants for extended periods were at a much higher risk of becoming obese. This revelation raises important questions about the long-term implications of antidepressant use. While these medications are undeniably effective in treating mood disorders, the impact on weight gain is a critical consideration that often goes underreported in the doctor-patient conversation. As Dr. Gabriella Lugo, a key researcher from the study, pointed out, prescribing antidepressants without weighing the risk of weight gain is a problematic approach. As the study shows, even when controlling for diet and exercise, antidepressants still played a significant role in the weight changes observed. Serotonin's role in weight gain is an area that requires further exploration. SSRIs increase serotonin levels in the brain, which initially may suppress appetite and promote feelings of satiety. However, over time, the body adapts by reducing the number of serotonin receptors, a phenomenon known as serotonin resistance. This adaptation can lead to cravings, particularly for high-carb or sugary foods, as the brain seeks to boost serotonin levels again. The result is a cycle where the individual eats more, which leads to weight gain. This process becomes even more problematic the longer the medication is used, as the brain's adaptation to serotonin resistance compounds the effects. For patients on antidepressants, this creates a delicate balancing act. The very drugs that help manage mental health symptoms may also set the stage for a range of other health issues. As Dr. Perez, another lead researcher, emphasized, it's important for medical professionals to explore alternative treatment options or complementary therapies to manage the weight gain side effect. However, patients should not attempt to stop their medications without first consulting their healthcare providers. Discontinuing antidepressants can lead to serious withdrawal symptoms, and these medications should be tapered off gradually under medical supervision. This study serves as a sobering reminder that while antidepressants can be life-saving for many individuals, they come with risks that must be carefully considered. The possibility of weight gain and the subsequent risk of obesity, diabetes, heart disease, and joint issues should be a key part of the conversation between doctors and patients. Patients must be fully informed about the potential long-term effects of antidepressant use, and alternative strategies should be explored to mitigate these risks. For those struggling with depression or anxiety, it is crucial to have open, honest discussions with healthcare providers about the potential benefits and drawbacks of these medications, especially when it comes to weight management and overall health.